Hi, I'm Dr. Mark Krog, board-certified cardiologist, and I want to talk about a scary diagnosis that we tend to not always appreciate. It's called atrial fibrillation. Atrial fibrillation, or AFib, is the most common arrhythmia that we see that's an irregular rhythm, and you might feel it as a palpitation or a skip beats, and something serious may happen without ever knowing the cause. So the most dangerous catastrophic consequence of atrial fibrillation is a stroke. And many times people don't realize they're having atrial fibrillation until they show up with a stroke at the emergency room. So of course that's a really scary situation. So let's talk about the 3 signs you shouldn't ignore as far as trying to figure out if I have atrial fibrillation. So number 1, the common thing that we think about is fluttering or palpitations or irregular beats. So it may feel like your heart is pounding, it's irregular, there's a butterfly flying around in there, you have a flip-flopping or this thumping of the chest where the heartbeats are just out of rhythm. Even just short episodes can lead to the catastrophic consequence of a stroke. And then we have symptom 2. People can be short of breath, fatigue, feel weak, like breathless or out of shape. So there's these brief seconds or brief moments where you might feel that way and then you go normal. That could be atrial fibrillation. And then there's this 3rd symptom, or shortness of breath, where people feel like weak, breathless, they're trying to exert themselves, they just have real easy fatigue and real short of breath with mild exertion. So just to review those 3 main things: palpitations or fluttering, unexplained kind of fatigue or weakness, and then the 3rd one is like shortness of breath or dizziness or lightheadedness. Now, bonus tip, or this thing that really keeps me awake at night as a cardiologist, the things that are real scary, is that we're going to miss atrial fibrillation in a patient, and it's because they don't even feel anything at all, especially in older patients. You might have no symptoms at all and wondering, wow, my watch is lighting up. It's got irregular beats. Do I have atrial fibrillation? And so that's where there's this call to action. If you have any of these sort of things, skip beats, irregular beats on your watch, any sort of feeling of fatigue, breathless, or you have risk factors for atrial fibrillation, things like high blood pressure, diabetes, sleep apnea, a stiff heart syndrome, any of these kind of risk factors, they're at risk for atrial fibrillation and don't even know it. So it's really a call to action to start screening for that. And that's where a device like this may be relevant, where you take KardiaMobile or even your watch and you check your beats or your rhythms just daily in the morning. And then if anything lights up there of concern, that's when you're going to take it into the cardiologist and review it and see if maybe you're having atrial fibrillation.